Hello, and welcome to another episode of Healthy Minds. I'm Julie, your host. This episode is part of our Black Mental Health Matter series. I have a super special returning guest joining me today. Would you like to say hello and introduce yourself?
Hi, my name is Anita Cager. Happy to be back. Love doing this. I'm one of the trainers for Inquiring Mind LLC. I feel like my job title changes every time I come on here. But now I'm a program coordinator for a targeted case management program. I help individuals with mental illnesses and help, get them in the community and link them to benefits and stuff.
Yay. And I think you're right that your title does change.
Every time, every episode has changed. That's okay. I'm in the same place though.
That's good. We'll just wait to invite you back for your next job then.
Thank you.
Okay, so Anita also has a background in nursing, and she is joining us today to talk a little bit about the impact of racism in the medical world on Black mental health and, of course, just regular health, right? So we wanted to kind of start with a discussion about representation in the field itself. So, what are we looking at? Are there a lot of people of color that are doctors and nurses?
So sadly, no, there aren't. There's with the physicians, there's 56.2% white physicians. There's only like 5% African-American physicians. And with nursing, and it's funny, when looking at the stats, I was actually surprised at the number of African-American nurses. There are only there's 80% white nurses and 6.2% African-American nurses. And I was surprised at first, but then I really thought about it back to when I was in nursing school and whatnot. And I started off going to Towson University, and I was doing my prerequisites there and whatnot. And, I was around a lot of white people. I was probably one of the only Black people, not too many doing it, unfortunately, in that school. But I ended up, I guess, getting discouraged when talking to people because they were saying they weren't getting into the program because their GPA was higher than mine, and they were getting into the program. So I was like, oh my God, I can't compete with them. I gotta go. So I ended up going to an HBCU and getting in. So I don't know if maybe that happens with other people, but that was my personal experience. But sadly, numbers are so low for African Americans with physicians and nurses.
Yeah, I was actually surprised by this as well. And I think that maybe we have a little bit of a skewed data because we live in Baltimore area. And so when we were chatting for this podcast, I was telling you that my last 5 doctors that I've seen have all been people of color.
Right.
And I didn't really think about it. And I was surprised by the nursing, especially because I thought that those numbers would be a lot higher. But I think the data you pulled was the RN, right? So there could be a ton of LPNs that
LPN, CNAs, exactly.
Yeah.
Exactly.
Yeah. And those are, for those that don't know, RNs are the higher degree of nursing.
Yes.
So LPNs need an associate's degree. Is that right?
So no, LPNs just go to a trade school. So you can be an RN and have an associate's and a bachelor's and still be an RN. So LPN is just different schooling. They don't have to go a 4-year college.
Right. And that would be a lot more accessible for many people. And we've already kind of talked about the impact of redlining and where you live and education and access to education. And so there's a whole lot there. We could probably just do a singular episode on representation in the medical field. But we want to keep rolling and get into some of the other things here. So something that I found really interesting that's been circling on the internet lately has been this, and I cannot remember the medical student's name.
I know.
It's so terrible.
His first name's Malone, but I don't want to butcher anything.
Not Post Malone, to be clear. But,
no.
Anyway, this medical student wrote a guidebook on using people of color in descriptions for how stuff like rashes look. And I was like, what? It's 2020.
Right.
And I was so confused. I was like, oh, yay. And then I was like, oh, wait, hold on. 2020, shouldn't we have textbooks with images of them that show non-white skin?
Mm-hmm. So I agree, and I actually did some research because I couldn't believe it. I was like, there's no way it took this long. And there's actually a couple books. There's the Dermatology Atlas for Skin of Color. I couldn't find I was trying to look real fast. I didn't find the actual when it was published. And there's like the Atlas of African American Dermatology, and that's just 400 pages of compares colored skin to white skin. So I was like, okay, I feel a little bit better. Now, granted, these books are like $100, $140, but either way, it's well needed because you have, if you and I get one disorder, for you, it might be a bunch of red dots. For me, I just have hives and I could be misdiagnosed completely. So it's really scary though.
Yeah, and that's a great point, and this is a point of white privilege here. I just want to specify that I was like astounded that textbooks did not have people of color represented, and I don't have any nursing textbooks to like verify myself. It's possible that some textbooks are doing a better job, but I have to assume that because the psychology textbooks often show white folks or people without any color. I'm not sure if you've seen these weird cartoon people with no color in them. But anyway, it goes to show where the white privilege comes from, right? So if I wrote a textbook, I may not even stop and think about stuff like that. And I hope that's the case. And if not, we're going to leave those people out kind of situation, but you never know, right?
Exactly. Yeah.
And I'm trying to think, it was with Tierney Thurmond who came on and did the history of racial trauma. We did discuss the James Marion Sims, father of gynecology, his absurd experiments. I highly recommend people look this up. It is astounding to see what was done. Yeah, very terrible. We talked about Henrietta Lacks, of course, and there was that really popular Oprah movie and Oprah book club book that came out talking about it. And then the Tuskegee experiment as well. So those are maybe like the three big ones that we talk about in Black medical history, as far as atrocities, to be clear. And then, so, you can go back and listen, you can do some Googling, but the other thing that we've also talked about that we wanted to get into a little bit more in depth today was adverse childhood experiences. So we're going to revisit them super quickly. I don't know if you have the list pulled up of the 10 adverse childhood experiences, that's okay. If not, I can quickly go through them, but we know that they don't experience them equally, right? That the different races and ethnicities will experience different rates of adverse childhood experiences or ACEs. So for those listening, that's like you've lost a parent, they've either died, they've gone to jail, maybe your parents use drugs or have a severe mental health problem. Any sort of abuse or neglect would also qualify. And then there's like 10 core, and then some researchers have expanded that to look at some other adverse childhood experiences. So I just was reading this interesting article about community violence should be considered an adverse childhood experience, which I would agree that if you've witnessed community violence or the impact of community violence, maybe you didn't watch that violent act happen, but you've seen the ripple effect in your community, could also be considered an adverse childhood experience. If not the certified 10, but they're talking about expanding that a little bit because they know that there's an impact. So I think you have the stats on the impacts of race, ethnicity, adverse childhood experiences, all that stuff.
Do I, Julie? Yes, I do.
Okay.
So as you said, different children of different races, they don't experience the ACEs equally. So nationally, 61% of Black children and 51% of Latinx children have experienced at least one ACE, compared with 40% of white children and only 23% of Asian children. So obviously, from those stats, the prevalence with ACEs is highest among Black children, sadly.
Yeah. And there's a lot of reasons why that may be, right? I mean, we've kind of unpacked those in some of our other episodes with redlining, et cetera. We are hoping to get someone in to come talk about voting and the impact there, and then also somebody to come talk about the criminal justice system, and how it is disproportionately in favor of white folks in general. So when we talk about adverse childhood experiences, some of those impacts that can pop up. So again, we've talked about this before on the podcast in a anxiety episode, and I think also a trauma episode, PTSD episode. So you're welcome to, page on back for them. But let's see, some of those impacts. Earlier death, right? Higher rates of heart disease, diabetes, cancer, earlier school dropout, more likely to use drugs. What else? Miscarriage, preterm births. There's a whole lot in there. And you can go to the CDC website and look it up. They have some really nice graphics. You can tune back in for an earlier episode. And so let's talk about maybe the mechanism behind why adverse childhood experiences do all these different impacts. And again, there's so many that we would just take 30 minutes and list them all. So we're not going to do that to you. So adverse childhood experiences, some people just call it trauma or stress or anxiety, whatever the jazz may be. But please walk us through what's going on. Why does this
Yes. We have this lovely thing in our body called the HPA pathway, also known as the hypothalamic pituitary adrenal pathway. Excuse me. And that basically controls our stress. It's like the powerhouse for our stress. And it works with our nervous system. And within our nervous system, without going too deep, we have something called cortisol. And cortisol is also linked to stress, and having long-term stress can increase your cortisol, which can lead to those heart issues, those weight gain, cognitive deficits, all kinds of things. So that can definitely play a role in all this stuff.
And I think everybody listening can relate, right? When you're stressed, you tend to want to go seek out sweets. I'm speaking for myself here, but I think that's a common experience. Point me to the ice cream or the chocolate or the donuts, and it just is it's there. And that's because cortisol is spiking our insulin, right? So it's like, go find something to fix this.
Yes.
And unsurprisingly, if you are stressed and eating maybe more ice cream and stuff than you used to, that would cause weight gain. But that's kind of a self-reinforcing cycle as well, because then you're like, oh, this is how much I eat now. Great, let's keep that up. And also, I think people can relate to not sleeping well if they're stressed, feeling all that tension, being tired, cranky, not thinking clearly.
Not being able to concentrate. Exactly. Yep.
And it's really interesting. So it's kind of like a vicious cycle, right? So you're stressed, so you turn to things that are probably not the best coping skills, like eating a donut or some ice cream. And then this doesn't make you feel very good because you're not addressing what's going on, right? You're just slapping a Band-Aid on it. And so then because you don't feel good, you're like, well, the donut helped, so let me try that again, right? And then you just kind of keep going.
It's a vicious cycle.
And it's just really interesting to see how that pops up for folks. So I do know that we were planning on talking about it today, but turning to we call them maladaptive coping strategies, aka poor coping skills, right? And how that may be disproportionately done by people of color. And I don't know if you want to talk about that a little bit.
Okay. So I think when it comes to people of color, unfortunately, like I grew up in the city. I live in the city now. And, one of the things one of the maladaptive coping skills, gambling. And for some reason, not just like going to the casino gambling, but like you go outside and people are shooting dice. That's what they call it. And they may not realize that that's a maladaptive coping I'm sure they don't realize that's a maladaptive coping mechanism. But it is, and it's something that they grew up learning to do, but it's not really healthy in the long run. And like you said, the overeating sometimes, and unfortunately there's drug use when it comes to long-term stress. You were just finding something to put that Band-Aid on and help you feel better. And I guess eventually we'll talk about how the drug use and the doctors and drug seeking and trying to, cope with things, and how doctors don't prescribe the opiates because they think that you're drug seeking. We're gonna talk about it now. It doesn't matter.
Yeah, go for it. Brought it up.
So, when it comes to African Americans, unfortunately, a lot of doctors don't want to prescribe like opioids or whatever the case may be to help with the pain, because I know I saw a stat that some medical doctors or student doctors actually think that African Americans have thicker skin. I don't know if they mean literally, but I'm taking it as emotionally. We have thicker skin. Now, I'm pretty sure, Julie, me and you got the same kind of skin at the end of the day. But there's also some belief that African Americans have their nerve endings are less sensitive. Well, I didn't learn that when I was in nursing school anywhere. I'm pretty sure they're all the same as well. But when I was doing my internship for nursing, I had my preceptor, and we were in a hospital in Baltimore City, and she would always say, "Those are the frequent flyers. Those are frequent flyers." But I'm like, well, what? And one thing they always complained about was abdominal pain, and they would come in and they would just read off what they wanted. But my concern was, well, what about that one time when they actually have internal bleeding, or something is really going on and the doctors really aren't looking at them? They're just trying to get them in and out. And I might be going on a tangent right now, but that's just something that comes to mind for me. Yeah, it's just sad.
The frequent flyer thing is a really unflattering term that folks use in the mental health world as well. And I have been guilty of using that phrase before myself. And it took me a little while to kind of be like, I don't like this. I don't like it, because it's that boy who cried wolf kind of scenario, right? So, maybe they are, quote unquote, a frequent flyer, but they also, there's something going on that's not being met that they need. And why are we just, giving them a Band-Aid and tossing them out the door if there's something going on? If you see them 20 times a month, probably they need something from you.
Exactly. I agree.
So let me think. We briefly touched on the topic of racial battle fatigue, and this was another one of those things. Sorry, in the episode with Tierney, we're going to bring it up now. Racial battle fatigue is one of those things that I think folks are starting to consider maybe one of those tangent adverse childhood experiences because of the same way that it works. So would you like to talk to us a little bit about racial battle fatigue?
Sure. So I apologize. I don't have the actual definition. Julie, do you have the actual definition on hand? I do apologize.
Okay. So it is the daily battle of experiencing racial slights, insults, stereotypes, discrimination, etc.
Oh, well, see, that's the definition I had too. But so with racial battle fatigue, it's definitely something new that people are starting to realize about now. And it's basically that stress from being in a hostile environment. I think the definition that, was it William Smith coined? I believe that he coined, it had to do with actual being on campus and in a school environment, but it can go anywhere with work. And I know they compare it to the what like veterans go through on a battlefield, which is deep when you think about it. And it's actually also compared to PTSD. Not exactly the same, but it can be that severe. People are on guard. They're just kind of waiting for those microaggressions to occur. You feel like you always have to be ready with a comeback because you might be insulted or attacked by someone. There's anxiety, you're worried, you're hypervigilant, headaches, increased heart rate, blood pressure goes up. So it takes a toll on a person's body. And Yeah, it's funny because now that I'm learning about this term, I really think that a lot of people that I know are going through it and there's no name for it. We're telling people seek help. But when I'm talking to coworkers, it's like, well, you might be depressed or you might be anxious, but this could just be like racial battle fatigue, and we need to hurry up and get this like in a DSM-5 or something. It just needs to be a diagnosis at this point.
Yeah, I agree. I think that, and maybe we can talk about this a little bit here, but I think that there's been a large problem with the white dominated field being the white majority telling other people how they're supposed to feel. I would not come up with this definition by myself.
Right.
I haven't experienced it, right? So why would the people that write the DSM, which I'm assuming are a bunch of white men, because that's the standard for the doctoral level of practicing psychologists and psychiatrists, tend to be a lot of white men. And then when we get into the therapy, so master's level, a lot of white females. And this is the majority. I want to be clear. There's obviously obviously people of color that are therapists, and psychiatrists, and all that stuff.
Of course.
But I think it's important to note, like, if I'm a therapist and you're experiencing racial battle fatigue and you come talk to me and I don't know what that is, nor have I experienced it, I would be like, oh, well, you're just anxious. You're experiencing anxiety.
You're just depressed.
Right. And you are, but there's a real cause to it, right? And so you can't really move forward in treating well without understanding what's going on, that iceberg kind of piece, right? So yeah, you're anxious and I can hand you a Xanax, but that's not going to help with the problem.
Right. Yep.
Okay, so super interesting concept, and we'll come back to that. Okay, so what are some of the real impacts of the medical racism that we're talking about? So the representation, access to healthcare, preconceived notions like the thicker skin stuff, et cetera.
So some of those impacts, for one of them, with everything going on right now, sadly, Blacks are more likely to get COVID over white people. Excuse me. We already said that, Blacks are less likely to get painkillers compared to other people. And overall, it just causes an increase of stress, which leads to those physical health issues down the line. I guess to talk about things with COVID, since it's all going on right now. So people say, well, why are African Americans more affected by COVID than whites, or whatever the case may be? And I mean, if you look at Baltimore City, with population density, there's like 7,000 people per square mile compared to like Howard County, where it might be like 1,000 people. So in Baltimore City, there's row homes for days, apartments, there's the projects, and people are just living on top of each other. Not saying they're not social distancing or what the case may be, but the living conditions aren't conducive to, actually try to fight these things. Then you have a lot of African Americans who are essential workers, may not just be in the hospital, but bus drivers, truck drivers, sometimes just a custodian, and they're being exposed to these things. So some of those impacts that we're going through.
Yeah. And I think it's important to note that this ties into that generational wealth that I was talking about with Natalie in the last episode. So I'm just going to use us as an example, Anita. So I am a professor. I'm teaching from home, and I have been since March 13th. Right. And so I leave my house once every week and a half or so. Right. What are you up to, Anita?
Oh gosh, I leave my house 5 days a week to go to work. And granted, that's not for my full-time job. I can work from home for my full-time job, but my part-time jobs, I have to be there every day in person. So yeah.
And you're working with people, I'm working with people, we're working with them in different ways. And it's great that you do have the flexibility to work from home, but it would be really hard to do most of your job, I would say. Some parts of your job from home.
Yeah, because people's lives don't just stop. You hold on now. Don't go to the doctors. Don't worry about anything. You just wait until this is over, and I'll be right there.
See you in a year or something, right?
Yeah, you be strong. That's my saying.
Oh goodness. And then of course we've been seeing the lack of personal protective equipment, the PPE, right? And so in the poorer areas, which again we learned from Natalie are probably heavily people of color, though not always, but likely they're not going to have enough resources to get protective equipment, or maybe they have like a mask, right? And so that's a problem because some of them are disposable, some of them you got to wash. I mean, there's a lot going on. And I would also argue, and I'm just going to quickly talk about this, that maybe they haven't been given the education about how to wear them and the washing the hands and all that stuff. I know Howard County has been on the ball with all their messaging and stuff. I don't follow anyone in Baltimore City or anything like that, but I have to imagine, like, if you don't have the internet and you're not like on the social media stuff, maybe you're not getting the information to begin with.
Yeah, that's probably the case. And when all this started in regards to PPE, and they said that they had to wear it on the bus and public places, I was petrified. Like, I'm about to go out and hand out masks to people, like they may not be able to have access to it. Because honestly, I wouldn't have had a mask if it wasn't for my job. So, but luckily, I mean, that first day, people had the resources and they had their masks. But like you said, they may not know, that you need to take it off and, put it away somewhere. Don't just leave it hanging around, or whatever. So,
right.
Yeah.
Right. Or they might wear it under their nose or something like that.
Yeah,
right?
A headband.
My favorite was I watched someone pull their mask off to cough, and I was like, no, that's the whole point of it. And this was a white lady in Target, to be clear, but I was like, what are you doing? That's the whole point of the mask. I know it's weird to sneeze and cough into the mask, but that's the whole point.
That's the whole point.
This is literally the whole point. Okay, so let's talk about, before we get on this whole mask PSA here. But you mentioned being less likely to be prescribed painkillers. I find that so interesting. And I know that, maybe you don't have too much information about that, but I just found that really interesting.
Yeah. I wish I had more stats and was more prepared, but I mean, it's just, I can give a personal story. So sure. I have, not a personal, but a personal work story. I had a client that was going to a doctor, because I knew they prescribed something to help with certain things. And that person was white. So I was like, I can get this other client to go there and get prescribed the same thing because, she's going to be really open to it. Turned out, wasn't the case. Wasn't the case at all. And that person was African-American. And the client called me afterwards and was like, that person asked me so many questions, like, well, why don't you just get off of that drug? You don't need that drug. You're better than that drug. And I'm like, well, but so-and-so, you prescribe that freely to him. Is it because he's white? Is it? So, and it's just sad because there's so many, I guess, subconscious thoughts that doctors may have. And in the end, it's hurting people. And, a lot of African-Americans are in jail because of illegal drugs, selling drugs, whatever the case may be. And it's cheaper to just help give them treatment than it is to keep them in jail for however long. So it's just sad.
Yeah, I agree. And I want to be clear that white folks are more likely to distribute and all sorts of things. Yes. And they get lesser sentences than Black folks that are using, which is not right, in case you're wondering.
At all.
Right. So let's see. Heart disease. We've kind of danced around that. You want to talk about that a little bit?
I guess the risk factors or whatever the case may be.
Yeah.
So as we know, unfortunately, African Americans have higher cases of heart disease. And I'm just going to talk about my personal opinion for that. In Baltimore City, there aren't really many grocery stores. It's kind of going a little too deep, but that's something that could lead to them having to eat unhealthy. Let's see where I am. There is a grocery store, but that's on the Baltimore City line. But when you don't have a car and you don't have someone to help you get there, who's really walking from that grocery store all the way to their house in this weather? Not me. Luckily, I have a car though. But one thing there's a lot of liquor stores, and there's a lot of corner stores. And for those of you who don't know what a corner store is, a corner store, it doesn't have produce and meats and stuff. There's things you can grab on the go, and maybe you give a juice box to your son or daughter. So it's all these different environmental things that African Americans have to deal with that I think lead to the heart disease, the high blood pressure, the diabetes, just trying to make things work on a limited income or whatever the case may be.
Yeah. And I think it's also important to note the kind of that same unconscious bias stuff that we were talking about as well. Maybe unconsciously doctors or nurses are like, well, it's quote unquote normal for folks to be overweight if they're Black, if they're Latinx, whatever. And I would argue it's normal for everyone to be overweight at the moment because America is overweight. But it doesn't mean that we still don't want to address the potential health impacts of it. Everything there. So I do have the stat. It says Black people are 30% more likely than white people to die prematurely from heart disease, and that Black men are twice as likely as white men to die prematurely from strokes. Yeah. And so, there it is. Boom, right? I mean, it's just the numbers. You can't really argue with them. There's clearly something going on there. So talking about obesity, what do we have? Non-Hispanic Black. So, just Black folks without any Latinx heritage, it's 49.6%. And then we have the Latinx folks at about 45% are overweight, and then white folks are 42%, and Asian are 17%. So again, we have Black folks are, the higher rates of obesity. I mean, it's not much difference between like 49 and 42 when you look at it. But that is pretty significant. We're talking about half basically of Black folks being obese, which is different than overweight. If you're using the traditional medical like kind of scale model, there's you're overweight and then you're obese, right? So I want to talk about the pregnancy stuff. I think that's so interesting. I was just taking a prenatal development class, and I learned about racism and its impact on pregnancy. And I was like, what? It just blew my mind. It was a 30-minute documentary, super fascinating. So let's get into it.
All right. So do you have some? I know I have some stats. You have some stats, whatever. So I know Black women are 4 times more likely to suffer from maternal morbidity and mortality than compared to white women. Make sure I get my other stats. I do have some infant mortality stats, which are sad. But
hold on. Let me translate this out of medical jargon. Black women are 4 times more likely to die than white women after pregnancy. So I wanted to just make that.
Thank you. No, thank you.
Yeah.
And in regards to infant death rates, it comes to 11.4 for non-Hispanic Blacks, 9.4 for American Indian, 7.4 for Native, Hawaiian. I lost my other stat. I'm sorry.
I think it's 5 for white babies, and this is per 1,000, I believe.
Thank you. Yes.
And this is here in the U.S.
Right.
And I don't know if I pulled that stat, but the U.S. is so far behind the other Western countries as far as maternal health and infant health. So this is something I talk about in my lifespan development class, and people are always like, "Oh my gosh, America's great," and we're not going to get into all that today.
Nope, not today.
I think we're 34th.
Say it again.
34th in the world for maternal safety.
Wow.
Yeah. Yeah, and that's largely because of our Black women's mortality and infant mortality rate because they're not being treated well. Like
Right.
for
Right.
whatever the case may
Whatever the
be.
case
There's
may
so many
be.
things,
Exactly.
right? I mean, barriers to healthcare, getting there, all this kind of stuff, right? The pain issue, so important. The not having accurate representation on skin colors and everything, and understanding the differences for things. And, you know, a lot of this, I just want to be clear, is probably covert, meaning that people aren't intentionally like being overtly racist against others. They might be. I mean, really, they might be, but
possibility.
probably a lot of this is unconscious learned behavior. And, you know, that doesn't excuse it, but I just want to be clear that it's not like doctors are out to get people or anything like that.
No, right, right.
But yeah, it's important to talk about. Okay. Preterm births, do you have those?
Yeah, so preterm Black babies are 1.6 times more likely, well, to actually have preterm babies, 1.6 times more likely to happen before 37 weeks, and 2.9 times for very mature before 32 weeks. So that's just, I'm thinking about those numbers. I'm like, well, and like you said, access to healthcare. And sometimes African American women just get poor quality treatment. They don't even know about prenatal care. And it's just sad.
Yeah.
Sometimes they're denied, like you said, the pain. They're denied certain things, certain medicines, whatever the case may be. And then these kind of things happen.
So the super great documentary, and I forgot to write down the name. But the thing that I learned is, you know, that racial battle fatigue kind of piece, although they just called it racism because they didn't have the fancy term for it. But the racial battle fatigue spikes your cortisol, just like the adverse childhood experiences and the regular stress that we were talking about. And it actually causes the uterus to contract. And so it is giving women basically starting labor earlier for them due to the discrimination that they're experiencing. And I found that super fascinating. I mean, horrible, but so fascinating to learn what your body does to kind of protect it. And so, you know, I want to just kind of like go over that a little bit. So if you're somebody that's been experiencing discrimination, whatever the case may be, race, ethnicity, disability, sexual orientation, whatever religion, this causes you to feel it, right? I mean, you can't just compartmentalize it and keep it in your head. It trickles out into the body. And so, you know, I have been discriminated against for my hearing before, and I know that I felt terrible about it, right? But I could literally feel myself clenching up, carrying that stress around. And while I only experienced that, like, you know, once at that moment, if you're somebody that's walking in a world that has been built to keep you down, you're going to experience this a lot more frequently than, you know, the one incident that I did, or, you know, whatever the 3 incidents that I've experienced. And so when you start to experience these over and over again, your system gets used to these higher levels of cortisol, and it kind of, I always talk about it going 2 ways, right? So either you become hyper vigilant and you're overreactive to stress and everything stresses you out. So like something that's like a 1 out of 10 kicks you up to like an 8 or a 9 because you've been boiling at a high level of stress compared to others. And then on the flip side, you shut down. You are under vigilant or hypo-vigilant if you want. So nothing is impacting you. That's also not healthy. You need to be able to experience stress and anxiety and have your body activate when needed. And if you're somebody that's kind of flat or numb or detached, that's also not healthy. And you also need to seek out care for that. So let's see. I know that you have some other pregnancy stuff.
So the long-term psychological toll, like you said, it, you know, can cause the different things. Like for Black women, we can have higher rates with preeclampsia. Preeclampsia is a pregnancy-related increase in your blood pressure. Embolisms can occur. Those are basically when your blood vessels are obstructed, and it can lead to like mental health conditions coming up during your pregnancy as well, and just in general when you're not pregnant. So all these stressors, you know, we walk not saying we, but walking around, you have all this coming down on you, and you have to know that it can take a toll on your body. And a lot of African Americans don't know about these diseases, and especially if they're not doing the prenatal care and see their doctor. And unfortunately, it can lead to those preterm babies, and it can lead to issues with the babies. So, yeah.
Yeah. So there's another term called weathering, and this is, I want to say, really similar to racial battle fatigue, like almost indistinguishable. I think that there's a different kind of mechanism for it. So racial battle fatigue is the like moment you're experiencing the wear down of discrimination and racism and all sorts of things. And then weathering is about the long-term impacts. So weathering, so I want you to think about maybe a stone that's in a river, right? And we know that eventually the stone gets worn down, right? And it becomes a nice smooth pebble. We like that in our rocks. We don't want our people to be worn down by the river of racism. And, you know, we know that it literally shortens life. So not only are people like more likely to die earlier from heart disease, but then this weathering can contribute to the life expectancy being shorter as well. And I think maybe you have those stats.
For life expectancies, yes, I do. So for life expectancies, oh, wait a minute, Julie, I apologize. We may have to cut this out because that's a stat. What was that stat for, Julie?
The life expectancy, it says white is 78.8. Do you see that?
No, but were they percentages?
No, that's the year. How long you live.
Okay. And so in regards to those life expectancies, so whites are expected to live to the age of 78.8. Blacks are expected to live to the age of 75.3. Those points kill me. But and in regards to Black males, they are expected to live to 71.9, and females 78.5. So not a huge difference, but it's big enough.
Yeah, and I think it's really impactful to look at the difference of Black female and the white average, because they're almost identical. So white was 78.8 and female 78.5. Then when we look at our Black males and they're at, let's just say 72 to stop all these points, that's a really big difference. That's 6 years. Yeah. And so there's a lot going on there. So of course the heart disease, the stroke that we talked about, right? You know, obesity in general is going to be a risk factor for a shorter life. But there's the weathering, the racial battle fatigue, drug use, all sorts of stuff. Okay, so let's switch into the psychological impacts of things here. And so just talk to me. What's going on with Black mental health? No pressure.
Oh, God, what isn't going on? I'm just fighting now. I think one of the things that I know in the Black community, we don't talk about our feelings too much, sadly, which can be a big issue because that causes for us not to seek out mental health care. Unfortunately, a lot of times it becomes spiritual and it's like God can fix it. And I'm somewhat spiritual, I'm not gonna get too much in that, but sometimes you need to talk to somebody as well. Sometimes my saying, you be strong, we tell ourselves, we be strong. And that's not always the case. Sometimes you need to, you know, vent. Sometimes you need to talk to somebody. And I know growing up for me, a little personal, you know, I went through some things, and it wasn't until I got to nursing school that I really learned what a therapist was and what that may be. It wasn't like my parents were like, you need to go to therapy, you need to talk to somebody about X, Y, Z. It wasn't until then that I figured it out. It was more of a, you know, you'll get over it, you'll be fine, you just take another day, you just, you know, whatever you have to do. And that's one of the things we have going on in our community. But some of the other psychological impacts, I know we talked about eating disorders and how they're misdiagnosed or not diagnosed at all with our Black individuals. Because you hear eating disorder, a lot of times you think the tall, white, skinny athlete, but there's many faces to that. And, you know, African American may go and talk to their doctor, tell them the same exact symptoms that a white client had, but they're not getting diagnosed for that eating disorder. And I mean, that can lead to, different things like having emotional stress, being angry, feeling helpless, being ashamed of different things. I know a lot of times, sometimes in Black community, we feel like we carry that shame and we can't, that we experience these things, but we're shameful for it, even though it's being done to us. And we don't want to seem like we're complaining, or we don't want to seek that help, so that it looks like, we're embarrassed or whatever the case may be. A lot of times we have that cognitive psychological impacts from things. So there's fear. I mean, with everything going on, there's a lot of fear. You keep experiencing things, and after a while you get numb to it, which isn't healthy, but that's something that happens. I know, Julie, you said you can have that hypervigilance, or you can have that hypovigilance, where you just, you're either on guard too much, or you're just like lackadaisical, like, hey, it can't happen to me kind of stuff. And sometimes there's that difficulty with interacting with individuals of a dominant group. That can definitely have an impact, especially in the workplace or going to school. Sometimes African Americans fear having to talk to someone of a different race. I think that's, yeah. And then, one thing. Sometimes when African Americans express themselves, and there's that anger or whatever the case may be, it's looked at as we're being argumentative, or we're trying to fight, or we're trying to be over controlling of things, when we're just expressing ourselves. But I hate to say it, but sometimes, like that angry Black woman, and that's something that society looks at us at when we're trying to just express who we are, and it's totally misconstrued.
Yeah. And I'm glad you brought up the quote unquote angry Black woman, because I think something that we haven't touched on is the quote unquote strong Black woman or strong Black man. And I think that is incredibly damaging for a lot of reasons. Do you want to talk about that a little bit?
Sure. So like I said, my saying, you be strong. I say it all the time, and I say it jokingly, but it's something that as Black people, we really believe that we have to be strong. I was talking to a coworker not too long ago about an incident, and we were talking about a white colleague that was dealing with something, and we were like, I said, if that was me, that wouldn't be the case. I would have to, still come to work, blah, 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 blah. And she's like, but that's not how it should be. You're a human being just like them. You feel just like you do, just like they do. And it's just, I don't know why. And, even when people ask how I'm doing, I might just say I'm just okay. It may not be the case at all, but I just feel like I have to come off like I'm strong. Nothing can bother me. And a lot of African Americans feel that way, sadly. And I think it's something that we all need to try to overcome somehow. But that's definitely something that's going on now these days. Sadly.
Yeah, and I think so. There's a lot of history behind this like strong Black person thing. So you can listen into that tyranny episode about the racial trauma, because we talk about it there a little bit. But I think it's really important to acknowledge that this is, and I'm just going to use you as an example because you brought it up. You said your parents didn't say go to therapy, right? Because the expectation is that you are going to be strong.
Exactly.
And you're going to figure it out because that's what you do.
Exactly. That's it.
And if the field is predominantly white folks who do not take into account weathering, racial battle fatigue, we haven't even gone into the double whammy of being a Black female, right? And having that kind of two quote unquote minority statuses and the impact of that on you as well. But I think it's just really important that we acknowledge that some of this is learned behavior to protect, to keep yourself safe, because doctors have not been safe to go see, right? Therapists have not been safe. It is not safe to talk to someone about your drug problem, likely, if you're Black. I would have to imagine that if you walk into a police station and you're a safe station, that you are going to probably be treated differently than if I did, just because of the color of my skin and your skin. Right. So I do want to talk about the stat for seeking out mental health care. So we have quoted this many times, and I am ashamed that I learned this statistic in the last week or two. So 42% of people are likely to seek out care for their mental health. And I have said that for years, right? This is something that I've known. But what I never have done is looked at the disparity between ethnicities. And I learned that 30% of Black folks are likely to seek out mental health care, and that it's actually like 50% of white folks are likely to seek out health care or mental health care. So I was astounded when I learned this. Like it hit hard because, you know, I've been running around saying 42% for years, and I've never once stopped and thought about who does this stat apply to? Like what's going on? And so we've talked about the strong Black woman, strong Black man, angry Black woman, angry Black man, maybe the parental kind of cultural aspect of you be strong. What else do you think maybe contributes to the disparity in seeking out care?
I mean, definitely just access to healthcare and not actually knowing, like I said, when I was younger, I didn't know what a therapist was. Just not knowing much about mental health and medical fields, and from talking to other people, sometimes just not trusting people. You know, you can Google on Psychology Today, all these people, therapists, and unfortunately, a lot of white people come up. And sometimes African Americans are seeking therapy because of that the racial issues that they've been dealing with, and they don't feel comfortable talking to a white person about their issues. And that's just something that I've, you know, because I'm all about therapy, and I've been trying to push people to, you know, during this time to just see therapists. And it's like, I don't want to see them because they're not going to understand what I'm going through. And there's, like in the city alone, there aren't many, well, there's a lot of, I've noticed like drug rehab centers, but I don't know where the closest mental health facility may be. So I can only imagine that other African Americans may not know as well.
Yeah. And I also want to acknowledge that folks maybe have gone to seek help.
Yes.
And then had a terrible experience.
Yes.
For one reason.
And that was it.
Now they're like,
I'm not doing this.
Yeah.
Right.
Yeah. So let's say you go in and you're like, I'm hurting. And they're like, oh, you're a frequent flyer. You're just looking for drugs or something like that. I mean, why the heck would you ever want to go see a doctor again?
I would never do that. Yeah.
Right.
And people don't realize that, unfortunately, with therapy, sometimes it's trial and error. And I know people don't want to hear that when you're going through something and you feel some kind of way, but your first therapist may not be the therapist that you stick with. You may have to see 2 or 3 people, sadly, to find that person that fits you. And that's okay as well. And people sometimes, you know, they just think it's a one and done. That was terrible. And everyone is going to be like that. But that's not the case.
Yeah. So something I saw that again, like the white privilege behind the statement, I acknowledge it. But, you know, when you go seek out a therapist and you ask them, what do you think the impact of racism and you know, white systemic practices are on your style of therapy? So asking the therapist about their views and asking them to acknowledge these unconscious biases or conscious biases and asking them the impact, because if you are a Black person seeking help, and let's say you find me, and I'm not a therapist, to be clear, but let's say Anita's looking for a therapist and she happens to show up on my doorstep in this imaginary world that we've created. And she asked me, what do I think about, you know, racism? And I'm like, oh, it's terrible. But I don't do that.
Right.
Would you want to come see me? Probably not.
No.
Because the reality is, and we've talked about this a couple of times, but I want to be really clear. If you are white or white passing, you come with a ton of privilege in this world. And it's not anything that you necessarily maybe have overtly done. It's not like you are choosing to be part of the system, but you are part of the system that is designed to keep others down. And so I used to say a therapist is a therapist. You can see anybody you want, and it shouldn't matter. A good therapist will talk to you no matter what. But I've really changed the way that I've thought about that over the last few years, because I would not want to go see a male therapist, right? They would never be able to relate to the experience of a large man looming over you, right? They don't understand that kind of fear. And I think the same thing goes for people that are not of the same race. And while, yes, absolutely, you probably could come talk to me and we could do some good work, but I wouldn't maybe be able to address all the parts of you. And I think that's important when you're going into therapy as well.
I agree.
Okay, so let's switch into, we've already kind of talked about like those maladaptive coping skills, but just like maybe briefly acknowledge. So I love that you brought up gambling, and I think it's really interesting you brought up the shooting dice thing.
Right.
So one, that's not something that I like it would occur to me to ever do. So I think that's fine that that's happening. But it's a learned behavior, right? I mean, they see their parents, their aunties, their uncles, all these people doing all these things, and so this is what you do. You're not going to be like, you know what, guys, I'm going to go for a 2-mile walk and hydrate and then go make myself a salad. Like, that's not, you're not going to
That's not something they learn to do, you know?
Right. And I love that you shared that it took going to college, and this is just a professor self of me, but it took you going to college to realize that there were other things to do, because you don't know until you seek out other stuff, right? So it's really important that you are always, doesn't matter who you are, you always diversify your knowledge. So watch different shows, read different books, all that kind of stuff, so you can figure out other perspectives. Because I guarantee you, myself included, that we have learned things that are wrong, and there are better ways to do things, or better ways for me to do things, because I'm not the same as, you know, my parents or my grandparents or whatever either. Drinking, substance use, gambling, shopping, stress eating, cigarette smoking. We didn't even get into all those stats. But yeah, so there's a lot of different quote unquote unhealthy ways to cope with stress. And while they work temporarily, it's important to know that it's not always the best idea. And so if it's working for now, great, but try to put those other good things in so that you can pull away from the negative. Yeah. Okay. So some action items to take if you are worried about medical racism. So we already mentioned asking a therapist what their views are on, and that would be like maybe one of my first questions if I were somebody worried about this, right? Hello,
I agree.
My name's Julie. You're Anita. Great. What are your views on the, you know, systemic racism that's rampant? How do you think that impacts me, or how do you think it impacts you? What else do you recommend for folks?
For one thing, people don't realize that they can do when someone doesn't want to treat you. You can get in writing from the doctor that they refuse to treat you, so that you have that with them for future whatever treatment. Yeah, that's all I got right now.
Okay, so I think that's a really great tool, because something that I think also is probably a little bit different, and this might be a cultural thing, is that I know that if I'm not getting the care I want, I'm gonna cause a fuss. And I have done so before. I have shown up in an ER and been like, I'm not leaving until you tell me what's wrong with me. And so, you know, you might not be safe to do that. You might have had negative experiences, etc. So if you ask someone to write down that they are refusing to give you a test or refusing to give you medication, this people don't like paper trails for a lot of reasons, because it holds them accountable. So they don't want to be, you know, if something happens, they don't want to be written up for malpractice or
liable. Exactly, whatever the case may be. Right.
Yeah. So it's really important that you kind of just gently push back, and this is a great way to do that. Okay, you don't want to test my thyroid levels. Can you please document that you're refusing to test my thyroid? And they're like, well, why don't you go get your thyroid tested, right?
Exactly. Now I can fit you in my schedule.
Right. Oh, wow, great. And then go find somebody else if you're not comfortable, I think is important, right? So if you're seeing someone and they refuse to talk to you like you're a human being for whatever reason, go find someone else. You don't have to stay with them.
Nope.
Okay. All right. It's time for my favorite part of the episode, self-care send off. What do you got for us, Anita?
Therapy, and more therapy. In this day and age, I know it's something that as African Americans that we sometimes don't want to do, but I am full support advocate. Talk to somebody, get that third party person involved. And also try to, even for our allies, I'm gonna give it for both ways. Get into some of that anti-racism literature. Look into it. I mean, these days YouTube has interviews and there's podcasts, and be comfortable with being uncomfortable, because as Black people, we've been uncomfortable for a long time. So teach yourself, teach your friends, teach your family, and just that's how you can help. If you have a question, what can I do? learn more about different things, more anti-racism things.
Yeah. We will have the link for the anti-racism resources in the show notes, so you can click on over if you want to find that. This is part of a series. You're welcome to go listen to those other episodes that I referenced. I don't even remember anymore. There's 5 or 6 in total at the moment, and we welcome feedback. So if there's an area that you would like to hear about, please let me know. You can find us on Instagram at inquiringus_minds_LLC. And of course, this is on Facebook. You comment, I'll see it because I'm tagged. So, let us know. Do you like it? Do you want Anita to come back and get a new job already? I'm just kidding. Sorry, Anita's employer, if you're listening, but no. So if you have ideas, suggestions, if you know someone, if you want to come share, like, this is what we're here for. So we'd love to hear a little bit more from you as well to help guide us. Like I said, I'm hoping to get someone on to come talk about voting, and I'm looking for someone right now on the criminal justice perspective or restorative justice perspective. So we welcome feedback and interaction. And I just want to thank Anita for coming on, for sharing with us today, being open about our own personal experiences. I think that the storytelling is what makes a difference for people to recognize what's going on, the numbers, but then bringing it into the human aspect. So thank you all so much for listening. We are wishing you good mental health.